After the age of 60, the body undergoes many changes subtle and significant that can affect how our digestive system functions. One of the most overlooked but telling changes is an increase in the frequency of gas or flatulence. While many people might chuckle or brush it off as a normal part of aging, it's important to understand that not all gas is harmless. In fact, a sudden or persistent increase in farting can serve as an early indicator that something deeper may be going on in your digestive health. And in later life, early detection often makes a critical difference. For seniors, a noticeable change in the frequency of gas should never be ignored, especially if it doesn't seem to be linked to any new foods or temporary stomach upsets. Our digestive system slows down with age. The stomach produces less acid, enzyme production drops, and the muscles that move food through the intestines may weaken. All of this means that food may take longer to digest, allowing more time for gas-producing bacteria in the gut to break it down. This, in itself, can increase gas. But when the frequency rises noticeably without a clear cause, it's worth paying attention. In many cases, an uptick in gas may be related to dietary sensitivities or intolerances that develop later in life. Lactose intolerance is a good example. Many older adults who had no trouble with dairy when they were younger suddenly find that milk, cheese, or ice cream now leaves them feeling bloated, gassy, or uncomfortable. This is because the body gradually produces less lactase, the enzyme that breaks down lactose as we age. If this enzyme deficiency goes undiagnosed, the continued consumption of dairy can cause chronic gas, bloating, and discomfort. Another potential culprit is undiagnosed celiac disease or gluten sensitivity. These conditions can develop or intensify later in life, and they often present with digestive symptoms such as gas, diarrhea, or abdominal discomfort. The intestinal damage caused by gluten in those with celiac disease not only leads to excessive gas but can also result in nutrient malabsorption, fatigue, and even bone loss, issues that are already of greater concern for the elderly. But sometimes, increased gas is not just about what you eat, it's about what might be going wrong inside the gut. Conditions like irritable bowel syndrome, IBS, diverticulitis, or small intestinal bacterial overgrowth, SIBO, are far more common in older adults than many people realize. With IBS, the communication between the brain and the gut gets disrupted, leading to altered bowel habits, abdominal pain, and often, excessive gas. While IBS itself is not life-threatening, it can drastically impact quality of life, especially if unmanaged. SIBO, on the other hand, is more serious. It occurs when bacteria that usually live in the large intestine begin to overpopulate the small intestine. These bacteria ferment food before it can be fully digested, leading to gas, bloating, discomfort, and even unintentional weight loss or nutritional deficiencies. Seniors are particularly vulnerable to SIBO due to factors like decreased stomach acid, slowed intestinal movement, and sometimes medications such as proton pump inhibitors or opioids, which can upset the normal balance of gut bacteria. Speaking of medications, it's also important to remember that polypharmacy, taking multiple medications, is common in older adults and can itself be a cause of increased flatulence. Some drugs, especially those affecting blood pressure, cholesterol, and diabetes, may interfere with digestion or gut flora balance, leading to changes in gas production. Antibiotics, even if taken months earlier, can wipe out good bacteria and pave the way for gas-producing organisms to take over. It's also worth considering psychological and lifestyle factors. Loneliness, stress, and anxiety, which unfortunately affect many seniors, can alter gut function. The brain and the digestive system are closely linked, and emotional disturbances can change how the gut moves and functions. Anxiety can speed up or slow down digestion, either of which can result in gas or bloating. Increased gas can also stem from a decrease in physical activity. Movement helps the digestive system function optimally. Seniors who are more sedentary due to mobility issues, chronic pain, or lack of motivation may find their digestive processes slowing down, leading to more fermentation and more gas. Encouraging regular gentle movement, such as walking or light stretching, can support digestion and ease symptoms. Hydration is another easily overlooked aspect. Many older adults do not drink enough water, whether due to decreased thirst sensation or concerns about frequent urination. But water helps keep the digestive tract running smoothly. Without adequate hydration, food moves more slowly through the intestines, giving bacteria more time to ferment again, producing more gas. If you or someone you care about has experienced a marked increase in farting after age 60, it's not a cause for shame, it's a cause for attention. It may not mean anything dangerous, but it also could be an early warning sign of a developing issue that would benefit from medical evaluation. Keeping a food and symptom diary can help identify patterns, and sharing that with a healthcare provider gives them a useful tool for diagnosis. Ultimately, the body speaks in subtle ways. Increased flatulence might be its way of asking for attention, whether to diet, lifestyle, education, or underlying health. It's not about fear, it's about listening closely to your body, respecting what it tells you, and responding wisely. After 60, that kind of vigilance can make all the difference in preserving comfort, dignity, and overall well-being. After the age of 60, it's important to pay closer attention to changes in your body, even those that might seem trivial, like the smell of your gas. While passing gas is a normal part of life and usually harmless, a sudden change in the odor, especially when it becomes unusually foul or putrid, should not be dismissed. It might seem like a minor embarrassment or just an inconvenience, but persistent, foul-smelling gas can be a sign that something is wrong within the digestive system. And in older adults, those signs should be taken seriously. The smell of gas is primarily determined by the types of bacteria in your gut and how they break down the foods you eat. Normally, the gut flora breaks down undigested food particles, producing gases like nitrogen, carbon dioxide, and methane, which are typically odorless. However, when sulfur-containing compounds are produced, such as hydrogen sulfide or methanethyl, the result is a strong, rotten egg or sewer-like smell. These sulfur compounds often point to a diet high in protein or cruciferous vegetables like broccoli and cabbage, which are not dangerous in themselves. But when the smell becomes more intense or persistent than usual, and especially if it is paired with other digestive symptoms, it can signal deeper issues. One possible cause of persistently foul-smelling gas is malabsorption. This means your body isn't properly absorbing nutrients from the food you eat. When certain nutrients, especially fats or proteins, pass undigested into the colon, bacteria feed on them, producing strong odors. Conditions like celiac disease, Crohn's disease, or chronic pancreatitis can impair nutrient absorption. In older adults, the pancreas may also become less efficient, leading to exocrine pancreatic insufficiency, a condition where the pancreas doesn't produce enough enzymes to properly digest food. One of the classic signs of IP is foul-smelling, oily stools and excessive smelly gas. Another condition to be aware of is colorectal cancer. Though it may seem unrelated, one of the more subtle early signs of colon cancer can be a change in bowel habits, including the nature of your gas. Tumors can obstruct or alter the normal function of the bowel, leading to fermentation and buildup of gas. Combined with bleeding or changes in stool appearance, persistent foul-smelling gas can be an important early warning sign that prompts screening. Colon cancer is more common in people over 60. So any persistent digestive symptoms, including changes in gas, should be discussed with a healthcare provider. Infections or gut dysbiosis can also cause excessively smelly gas. Dysbiosis refers to an imbalance in the gut bacteria when harmful bacteria overtake beneficial ones. This can happen after taking antibiotics, undergoing chemotherapy, eating a diet high in sugar and low in fiber, or simply due to age-related changes in gut flora. Dysbiosis can lead to fermentation of undigested food, resulting in gas that has a strong, offensive odor. It's also frequently associated with bloating, cramping, and irregular bowel movements. Certain parasitic infections or overgrowths of pathogens like Clostridium difficile, commonly known as C. diff, can cause smelly gas along with other symptoms like diarrhea, nausea, and abdominal pain. C. diff is particularly dangerous for older adults, especially those who have been hospitalized or recently taken antibiotics, as it can cause life-threatening inflammation of the colon. Dietary choices also play a major role. As people age, Their bodies may not handle certain foods as efficiently. A diet high in processed meats, fried foods, or artificial sweeteners can cause the gut to produce more foul-smelling gas. Additionally, people may eat less fiber, which helps regulate gut bacteria. Without sufficient fiber, harmful bacteria may thrive and produce stronger odors. Conversely, if someone suddenly increases their fiber intake, such as through supplements or diet changes, the resulting gas may be temporarily smelly until the body adjusts. Another important consideration is slow bowel transit time. As the digestive system ages, the muscles that push waste through the intestines can become less effective. This means food stays in the colon longer, giving bacteria more time to ferment it. This extended fermentation can create stronger, more pungent gas. Chronic constipation, a common in older adults, further exacerbates this problem. It's also worth noting that medications commonly taken by older adults can influence how gas smells. Iron supplements, certain antibiotics, and some pain medications can alter the balance of bacteria in the gut or affect digestion, resulting in more odorous gas. If you've noticed that your gas has become consistently more foul-smelling and it's not linked to recent dietary changes or medication, it's wise to observe your other digestive symptoms. Keep an eye out for signs such as fatigue, unexplained weight loss, changes in bowel habits, stomach pain, or blood in the stool. These may point to underlying health issues that need to be addressed. In many cases, adjusting your diet, improving hydration, taking a probiotic, or treating a bacterial imbalance can help restore gut health and reduce offensive odors. However, the key is not to ignore the warning signs. Foul-smelling gas is your body's way of signaling that something may not be right. And after 60, being proactive rather than dismissive about even the less pleasant symptoms can be the difference between catching a problem early or letting it grow into something more serious. Above all, trust your instincts and listen to your body. What seems small now may be the body's early whisper asking for attention. And in elder years, your body's whispers should always be respected. For individuals over 60, gas that comes with abdominal pain or bloating should be taken more seriously than at younger ages. While occasional discomfort is common, a consistent pattern of painful gas or frequent bloating can signal that your digestive system is no longer functioning optimally. At this stage of life, the body becomes more vulnerable to a variety of conditions that can impact how food is processed, and these symptoms may be the earliest indicators of something more serious brewing beneath the surface. It's important to understand that as we age, our digestive tract naturally slows down. The muscles in the stomach and intestines may weaken, and the production of digestive enzymes can decline. This can result in food not breaking down efficiently, leaving more undigested material for gut bacteria to ferment. The result: more gosset and often more discomfort with it. But pain and bloating aren't just uncomfortable, they often suggest that there's an imbalance, irritation, or even inflammation inside the digestive system. One common cause of gas with pain and bloating in older adults is diverticulosis, or its more serious counterpart, diverticulitis. Diverticulosis is a condition where small pouches form in the lining of the colon. These pouches can trap food and waste, leading to fermentation, gas, and localized discomfort. If one of these pouches becomes inflamed or infected, diverticulitis can occur, causing more intense pain, bloating, fever, and even nausea. This condition becomes increasingly common with age, especially in those over 60, and should not be ignored if symptoms persist or worsen. Another culprit is small intestinal bacterial overgrowth, SIBO. This condition occurs when bacteria that normally reside in the colon begin to populate the small intestine, where they don't belong. The small intestine isn't equipped to handle large numbers of bacteria, and when they start fermenting food there, the result is often significant bloating, frequent and painful gas, and sometimes diarrhea or constipation. SIBO can be caused by slower gut motility, a history of gastrointestinal surgery, or certain medications. All factors more common in older adults. Left untreated, SIBO can lead to malnutrition and vitamin deficiencies, which are already concerns in aging populations. Irritable bowel syndrome, IBS, is another condition that can manifest or worsen with age. It's characterized by recurring abdominal discomfort, bloating, and changes in bowel habits. While IBS isn't life-threatening, it can significantly impact quality of life. For seniors, the symptoms can be more disruptive, especially when combined with other age-related issues like decreased mobility or appetite. Gas pain in IBS is often crampy, and bloating may worsen after eating or at certain times of day. Stress and anxiety, which can increase in older age due to life changes or isolation, can also exacerbate IBS symptoms. In some cases, painful gas and bloating might be signs of a food intolerance or a sensitivity that's developed later in life. Many people over 60 become sensitive to dairy, lactose intolerance, or certain carbohydrates, like those found in beans, onions, or wheat. These substances ferment more easily in the gut, producing excessive gas and stretching the intestines, which can cause significant discomfort. What's tricky is that many people don't associate these symptoms with food, especially if the reaction occurs hours after eating. But recognizing and adjusting your diet can make a substantial difference in reducing pain and bloating. Constipation is another key contributor. In older adults, constipation can stem from reduced physical activity, dehydration, or the side effects of medications. When stool builds up in the colon, it can trap gas behind it, causing bloating and abdominal pain. The longer stool sits in the intestines, the more fermentation takes place, increasing gas volume and pressure. This pressure can cause cramping or sharp pain, especially in the lower abdomen. Regular bowel movements, staying hydrated, and increasing fiber intake gradually can help ease these symptoms. It's also essential to watch out for more serious conditions like intestinal blockages, gallbladder disease, or even ovarian or colon cancers, which can initially present with gas, bloating, and abdominal discomfort. While these are less common causes, they become more relevant with age. A partial blockage, for instance, might allow some stool or gas to pass, but still create enough back pressure in the gut to cause significant pain. If bloating is accompanied by weight loss, vomiting, fatigue, or changes in stool appearance, it warrants prompt medical attention. Another overlooked cause of gas-related pain is gas trapped in the bands of the colon, particularly in what's known as the splenic or hepatic flexures. This is often referred to as flexure syndrome. The gas becomes trapped in these high turns of the large intestine, causing sharp, localized pain that can mimic heart or gallbladder pain. It's not dangerous, but it can be extremely uncomfortable and is often mistaken for other medical problems. Older adults should also be mindful of their emotional well-being, as anxiety and stress can directly influence digestive health. The gut-brain axis is a real phenomenon, and emotional distress can change how the intestines move and contract. This can increase the sensation of pain from gas or make bloating feel more intense. In some cases, the gas itself isn't significantly higher, but the body becomes more sensitive to it, a condition known as visceral hypersensitivity, which is common in people with chronic gut issues. In summary, gas that is accompanied by pain or bloating after the age of 60 is not something to overlook or laugh off. It could be a symptom of a variety of underlying conditions, ranging from mild and manageable to serious and requiring medical attention. The key is to observe your body's patterns. When does the pain occur? What foods are involved? Are there other symptoms like fatigue, constipation, or weight loss? Listening to your body and seeking medical advice when something doesn't feel right is a wise, proactive approach to aging. At this stage of life, comfort and peace of mind are priceless. Paying attention to signs like gas-related pain and bloating and acting on them can help maintain a healthier, more independent life. Because the body always communicates, it's our responsibility to tune in. As people grow older, the body's internal systems, especially digestion, undergo significant changes. One of the more subtle but important signs of a possible issue is the presence of floating or foamy gas, often noticed alongside stools that don't sink or have an unusual, frothy appearance. While it may seem like a minor or even humorous observation, this type of gas can actually point to deeper issues, particularly with how the body processes fats. For anyone over 60, These signs deserve careful attention because they could indicate malabsorption or problems with key digestive organs like the pancreas, gallbladder, or liver. When gas appears foamy or when stools float persistently, it often means that fat isn't being digested properly. Normally, your body breaks down fat in the small intestine with the help of bile, produced by the liver and stored in the gallbladder, and digestive enzymes, primarily from the pancreas. But as we age, these systems don't always function as well as they used to. This decline can lead to fat malabsorption, a condition where undigested fat remains in the stool, causing it to float or appear greasy and bubbly. One of the most common causes of fat malabsorption in older adults is exocrine pancreatic insufficiency. This occurs when the pancreas does not produce enough digestive enzymes, particularly lipase, which is essential for breaking down fats. Without these enzymes, the fat in your food cannot be properly digested and absorbed, so it passes into the colon, where gut bacteria act on it and produce large amounts of gas. The result is stools that float, look oily, or break apart easily, and gas that may be foamy or unusually voluminous. It is particularly common in people with chronic pancreatitis, a history of alcohol use, diabetes, or certain autoimmune conditions, all of which become more prevalent with age. Another possible cause is gallbladder dysfunction, which is also more likely after age 60. The gallbladder's job is to release bile when fat enters the digestive tract. If the gallbladder isn't releasing bile properly due to gallstones, chronic inflammation, or post-surgical changes, fat won't be emulsified correctly, and much of it will remain undigested. This also results in stools and gas that float or look frothy. While some gallbladder issues are silent, many people notice a change in digestion after eating fatty meals. They feel gassy, bloated, or even nauseous. These are signals worth discussing with a doctor. Liver function plays a key role as well. Bile is produced by the liver, and if liver function is impaired due to fatty liver disease, hepatitis, or other conditions, the production and quality of bile can be reduced. This again leads to problems digesting fats. In older adults, liver health can quietly decline over time, especially in those with metabolic syndrome or who take multiple medications. Floating or foamy stools may be one of the first signs that something is not working right. Certain intestinal infections or overgrowths can also cause abnormal gas production. For example, Giardia, a microscopic parasite that can infect the intestines, is known to cause frothy, foul-smelling stools and gas. Though more common in places with poor water sanitation, Giardia can also occur sporadically in the general population and may affect seniors with weakened immune systems more severely. Even celiac disease, which involves an immune reaction to gluten, can cause fat malabsorption if undiagnosed or poorly managed. Celiac disease damages the lining of the small intestine, where nutrient absorption takes place. This damage interferes with the absorption of not only fats but also important vitamins and minerals. Floating stools, gas, bloating, and fatigue can all result. While celiac disease is often associated with younger people, it can be diagnosed for the first time well into one's 60s or 70s. It's also essential to consider the nutritional consequences of fat malabsorption. When the body can't properly digest and absorb fats, it also misses out on fat-soluble vitamins A, D, E, and K. Deficiencies in these vitamins can lead to a wide range of problems, from poor vision and fragile bones to bruising easily and increased risk of infection. In older adults, who are already at higher risk for osteoporosis, vision changes, and slower healing, missing out on these nutrients can accelerate health decline. Sometimes, dietary trends or changes introduced later in life feel like high-fat, low-carb diets can unintentionally strain a digestive system that's no longer as efficient. Seniors might follow a new diet without realizing that their pancreas or gallbladder is not capable of handling the increased fat load. This can lead to significant digestive upset and floating, gassy stools as the body struggles to cope. If you've recently changed your diet and noticed this kind of gas, it's worth reevaluating the balance of nutrients or getting lab tests to check digestive enzyme and bile production. If you're noticing frequent foamy gas, floating stools, or digestive changes that don't seem tied to specific foods, it's time to talk to your healthcare provider. They may suggest a stool analysis, pancreatic function tests, or ultrasound imaging to check the condition of the gallbladder and liver. These are non-invasive tests that can provide valuable insight into what might be going wrong and what can be done about it. Often, the solution involves simple steps, dietary adjustments, enzyme replacement therapy, or medications to improve bile flow. In some cases, supplements to replace missing vitamins can restore energy and prevent complications. But none of that can happen if the warning signs go unnoticed. Gas that floats, foams, or accompanies fatty stools may seem like a small detail, but in older adults, it can be a crucial signal of digestive distress. Paying attention to these subtle signs, and acting on them early, can protect your health, energy, and quality of life as you age. Because even something as ordinary as the way gas behaves can be the body's quiet way of saying, please take care of me. For those over the age of 60, frequent or excessive gas, especially when it's new or suddenly more intense, can be a red flag rather than just a dietary side effect. Many seniors experience a gradual shift in their digestion as part of normal aging, but when gas becomes unusually persistent, excessive, or uncomfortable, it's time to look deeper. This change might indicate that your gut is out of balance or reacting to a hidden issue. Your body may be trying to communicate something more serious, and it's crucial to pay attention. First, understand that the gut microbiome, the collection of bacteria and microorganisms living in your intestines, plays a central role in how gas is formed. A healthy gut microbiome digests food efficiently and produces manageable levels of gas. But over time, especially after 60, this bacterial balance can shift due to changes in diet, medications, decreased mobility, or illnesses. When harmful bacteria or yeasts outnumber the beneficial strains, gas can be produced in much larger volumes and with more intensity. This imbalance is called gut dysbiosis, and it often results in bloating, discomfort, irregular bowel movements, and so much more gas than normal. Another concern is slow digestive transit. As people age, the muscles in the gastrointestinal tract tend to weaken, and the nerve signals that keep everything moving smoothly can become less effective. This can lead to food lingering in the stomach or intestines longer than it should. The longer food sits, the more time bacteria have to ferment, and that's what creates excessive gas. A slower system also increases the chance of constipation, which can trap gas behind waste and lead to intense pressure and discomfort. So, if your gas is becoming more frequent, especially with signs of sluggish digestion, this might be a key contributing factor. Medications are another hidden cause of excessive gas in older adults. Many common prescriptions, like those for blood pressure, pain relief, diabetes, and even calcium supplements, can affect how your gut works. Some reduce stomach acid, which may seem helpful for heartburn, but low acid levels can prevent proper food breakdown and allow undigested particles to feed gas-producing bacteria in the intestines. Others interfere with gut motility or microbiome balance, leading to bloating and flatulence. If you've recently started or changed medications and noticed more gas, that may not be a coincidence. Chronic conditions that are more common in people over 60 can also be linked to frequent gas. Type 2 diabetes, for instance, can slow digestion through a condition called diabetic gastroparesis, where the stomach empties too slowly. This leads to fermentation, gas buildup, and bloating. Similarly, thyroid issues, particularly hypothyroidism, can slow down gut function and lead to more frequent gas. These underlying conditions often go undetected because symptoms like gas may be brushed off or misattributed to aging or diet. Food sensitivities and intolerances can also develop later in life, even if you've never had trouble with those foods before. Lactose intolerance, for example, becomes more common with age, as the body produces less lactates, the enzyme needed to digest dairy. Other fermentable carbohydrates, known as FODMAPs, can also become harder to digest with time. Foods like onions, garlic, beans, apples, and wheat can cause intense gas and bloating in sensitive individuals. If excessive gas starts to appear regularly after meals, it may be helpful to track what you're eating and identify potential triggers. There's also a link between emotional health and digestion. After 60, many people experience more stress, isolation, or anxiety due to life changes like retirement, loss of a spouse, or decreased independence. The gut-brain connection is real. Stress can alter gut motility and sensitivity, making gas more noticeable and harder to manage. In some cases, people become more aware of minor symptoms, and in others, the stress actually causes an uptick in gas production by disrupting the natural rhythms of digestion. Lastly, intestinal overgrowths or blockages, whether from scar tissue, tumors, or other issues, can also cause persistent or excessive gas. These problems are more likely to develop with age and may cause symptoms like abdominal pain, distension, or an unusual feeling of fullness. While rare, these should not be ruled out if the problem is new, severe, or accompanied by weight loss, fatigue, or changes in bowel habits. So what can be done about frequent gas at this stage of life? First, take it seriously. Track when it happens, what you ate beforehand, and how it feels. This simple step can help identify patterns or dietary triggers. Second, stay hydrated and physically active, as both help keep the digestive system moving. Don't underestimate the power of regular walking. It stimulates the intestines and helps release trapped gas. Third, talk to your doctor about your symptoms. They may suggest simple tests, review your medications, or recommend a referral to a gastroenterologist. Sometimes the solution is as simple as a probiotic or dietary adjustment. In other cases, more targeted treatments are needed. But no matter the cause, frequent gas is your body trying to get your attention. At 60 and beyond, it's always smarter to listen closely to those signs rather than ignore them, because even something as ordinary as passing gas can be your body's way of asking for help and ensuring you stay on the path of health, comfort, and vitality. After the age of 60, it's not uncommon to notice changes in how your digestive system reacts to certain foods. One particularly important signal to watch for is gas that smells unusually foul or sour, not just your typical unpleasant odor, but something that seems more intense, putrid, or unfamiliar. This change in odor isn't just a quirky side effect of aging. It can be a clear message from your body that something isn't right inside your digestive tract. In many cases, it could indicate problems with nutrient absorption, infection, or imbalances in gut bacteria. Understanding and responding to this signal can help prevent more serious issues down the line. First, consider the role of your gut bacteria. These microorganisms are responsible for breaking down parts of food that your stomach and small intestine can't digest on their own. When you have a healthy balance of gut flora, they help you absorb nutrients, protect you from harmful bacteria, and produce a manageable amount of gas. But when this balance is disrupted, a condition known as dysbiosis, the bacteria can begin to ferment food in unusual ways. The result: gas that smells distinctly worse than what you've experienced before. A foul odor is often caused by gases like hydrogen sulfide and methane, which are produced when sulfur-containing foods are fermented in an imbalanced gut. These gases tend to smell like rotten eggs or decay, and they're usually a red flag. What causes this imbalance? For seniors, it could be a number of things. Antibiotic use, even in the past, can permanently alter the makeup of your gut flora. Medications, such as those for acid reflux, like proton pump inhibitors, can also allow harmful bacteria to thrive. Poor diet, especially one high in sugar or processed foods, can feed the wrong types of bacteria and yeast. And age itself plays a role. Your immune system weakens over time, and your body may no longer regulate bacterial populations as efficiently as it once did. But total changes aren't always just about bacteria. Sometimes they point to malabsorption problems, where your body isn't processing certain nutrients correctly. For example, if your body isn't absorbing fats well, possibly due to pancreatic insufficiency, gallbladder dysfunction, or liver disease, those fats stay in your digestive tract longer, where bacteria act on them and produce gas that smells especially rancid. Similarly, if your intestines can't absorb certain proteins or carbohydrates, those nutrients become food for bacteria instead of nourishment for you. That microbial fermentation produces volatile compounds that give off strong, often offensive, Odors. Lactose intolerance is a classic example. Many people lose the ability to digest lactose, the sugar in milk, with age. When lactose reaches the colon undigested, bacteria break it down and release sulfurous gases. The same thing can happen with fructose, fruit sugar, and other fermentable carbs. If you notice foul-smelling gas soon after consuming dairy, fruit, or fiber-rich foods, your body might be trying to say, "I can't process this like I used to." Infections in the gut can also cause foul-smelling gas, especially Clostridium difficile, C. diff, a bacterium that often strikes older adults who have taken antibiotics recently. This infection can cause severe diarrhea, stomach pain, and gas with an unusually strong and offensive odor. While not common in healthy individuals, it can be very serious in older people, especially those with weakened immune systems or recent hospital stays. If smelly gas is paired with loose stools, urgency, or abdominal discomfort, you should not ignore it. Sometimes, bad-smelling gas can point to conditions like celiac disease, where gluten triggers damage in the small intestine and leads to poor absorption of nutrients. Or even more seriously, colon cancer or polyps, which can alter digestion, cause bleeding, and change the bacterial environment in the colon. Might first make themselves known through symptoms like unusually bad gas and stool changes. The key message here is that your body has a way of signaling distress, and one of those ways is through the quality and odor of your gas. If your flatulence starts to change and smell, becoming more foul, sour, or just distinctly different from what's normal for you, it's worth noting. Occasional dietary missteps can explain it, but persistent odor changes, especially if they're accompanied by bloating, irregular bowel movements, weight loss, or fatigue, need to be brought to a healthcare professional's attention. At this stage of life, it's especially important not to dismiss uncomfortable or embarrassing symptoms. Many serious health conditions in older adults start with subtle signs. Listening to your body's messages, yes, even the smelly ONESA, can lead to early detection, easier treatment, and better outcomes. Keep a food and symptom journal if needed, bring it to your appointments, and don't be afraid to speak openly with your doctor. Because after 60, your health depends on your willingness to pay attention, and not just to what hurts, but to what changes. And even something as common as flatulence can be the tip of the iceberg when it comes to your overall digestive wellness. After age 60, one of the more subtle yet potentially serious digestive signals your body may send is gas accompanied by bloating, abdominal pressure, or mild to moderate pain. Many seniors write this off as just normal aging or occasional discomfort after a meal, but recurring gas with physical discomfort is not something to ignore. It could be your body's way of alerting you to developing issues like chronic inflammation, bowel motility problems, or even early signs of more serious conditions such as intestinal blockages or tumors. Let's first talk about bloating and pressure. As we age, our digestion slows down, the stomach empties more slowly, and intestinal muscles don't move food through as efficiently. This slowing can cause food to ferment longer in the gut, especially if it contains fiber, sugar, alcohols, or poorly digested carbohydrates. That fermentation leads to the production of gas, and when gas builds up in a sluggish digestive tract, it creates bloating and uncomfortable pressure. For some older adults, this pressure builds throughout the day, especially after meals, and may be relieved only partially by passing gas or having a bowel movement. If this becomes a regular pattern, it's worth investigating, especially if it's new or growing worse. One of the most common culprits behind this type of discomfort is small intestinal bacterial overgrowth, SIBO. This condition occurs when bacteria that normally belong in the colon start to populate the small intestine, where they don't belong. In older adults, the risk of SIBO increases due to age-related changes in stomach acid levels, decreased intestinal motility, and certain medications, like proton pump inhibitors or opiates. When bacteria ferment food too early in the digestive process, gas forms in the small intestine, where it causes bloating, cramping, and often, excessive or foul-smelling gas. SIBO can also cause nutritional deficiencies, fatigue, and unintended weight losses, so it's not just a comfort issue, but a health risk. Abdominal pain with gas can also be tied to diverticulosis or diverticulitis, both of which become more common after age 60. These are conditions where small pouches form in the wall of the colon and either remain harmless, diverticulosis, or become inflamed or infected, diverticulitis. When these pouches trap gas or waste, they can cause sharp or dull pain, usually in the lower left abdomen, along with bloating, gas, and changes in bowel habits. It's especially important not to ignore gas when it's localized with tenderness or pain that comes and goes, or if the pain gets progressively worse. There's also irritable bowel syndrome, IBS, which, while not life-threatening, can be deeply uncomfortable and is surprisingly common in older adults, especially women. IBS often presents as gas with cramping, bloating, diarrhea, or constipation. The key feature of IBS is that symptoms fluctuate and are often triggered by stress or certain foods. Some people experience only mild symptoms, but for others, the gas and bloating can become disruptive to daily life. After 60, any new onset of IBS-like symptoms should be discussed with a doctor to rule out more serious conditions first. In rare but serious cases, colorectal cancer or polyps may begin showing up as vague symptoms like bloating, abdominal pressure, or a change in gas patterns. These symptoms may appear long before other warning signs like bleeding or weight loss. If you find yourself experiencing gas with pain that is persistent, worsening, or paired with changes in bowel habits, fatigue, or unintended weight changes, these are signals that should not be dismissed. Early detection of colon cancer is very treatable, but delayed recognition can be dangerous. Another concern in older adults is bowel obstruction, whether partial or full. These can happen from adhesions, scar tissue from past surgeries, hernias, or tumors. Gas in this case is often trapped behind the blockage, creating bloating, cramping, and discomfort that doesn't resolve with passing wind or using the bathroom. If gas builds without relief, especially with nausea, vomiting, or inability to pass stool, seek medical attention immediately. Also, keep in mind that poor posture and reduced physical activity, which become more common with age, can contribute to trapped gas and bloating. When we sit for long periods or move less, digestion slows even more. This creates a vicious cycle where gas accumulates, the abdominal muscles become weaker, and discomfort increases. Regular walking and gentle abdominal exercises can often make a noticeable difference. On a final note, emotional stress and anxiety, common in later life transitions, also have a strong impact on gut function. The nervous system in the gut, often called the second brain, reacts to stress by altering bowel motility and sensitivity. For some seniors, emotional tension translates directly into bloating and gas pain. Learning to manage stress through relaxation techniques, breathing exercises, or mindfulness can ease not just your mind, but your belly too. In summary, gas that comes with bloating, discomfort, or pressure is more than an inconvenience. In older adults, it's a signal to look more closely at what's happening inside, whether it's a matter of gut motility, bacterial imbalance, inflammation, or something more serious. These are symptoms you should not quietly endure or brush off. Speak up, pay attention, and take action because your comfort, health, and peace of mind in your later years depend on it. After the age of 60, gas that comes with changes in bowel habits, especially loose stools, diarrhea, or constipation, can be a sign that your digestive system is struggling with more than just age-related slowdown. While occasional irregularity might be harmless, persistent or worsening symptoms paired with gas should not be overlooked. They may indicate food intolerances, chronic inflammation, medication side effects, or the early stages of serious gastrointestinal diseases. By understanding what these signals mean, you can take proactive steps to protect your long-term health. Let's begin with loose stools and diarrhea, especially when frequent and accompanied by gas. In seniors, this pattern is often caused by food intolerances or malabsorption issues. Lactose intolerance, for instance, becomes increasingly common as people age. Due to a gradual decline in the enzyme lactase, this means the body can't properly digest milk sugar, leading to fermentation in the gut, gas, cramping, and watery stools. The same thing can happen with fructose, fruit sugar, sorbitol, an artificial sweetener, or high-fiber foods. When these substances are not properly absorbed in the small intestine, they draw water into the colon and become fuel for gas-producing bacteria, resulting in bloating, loose bowel movements, and excessive flatulence. Chronic loose stools may also signal inflammatory bowel disease, IBD, such as ulcerative colitis or Crohn's disease, both of which can develop later in life. These conditions involve inflammation of the gut lining and often include symptoms like urgent diarrhea, blood in the stool, fatigue, and gas. Though less common than IBS, these diseases are more serious and can lead to nutritional deficiencies and long-term damage if left untreated. Any persistent change in bowel function deserves medical attention, especially if it involves gas with pain, urgency, or signs of inflammation. Now, let's look at the opposite issue, constipation with gas. This is actually quite common among people over 60 and can be more than just uncomfortably. It may be an indication of sluggish bowel motility, which slows the passage of food through the intestines. This slower movement gives more time for bacteria to ferment food, producing gas that becomes trapped behind hardened stools. The result is bloating, pressure, and painful, difficult bowel movements. Chronic constipation is not only unpleasant, but it can also lead to complications like diverticulosis, fecal impaction, and even rectal bleeding if straining becomes excessive. Constipation in older adults is often worsened by dehydration, lack of dietary fiber, reduced physical activity, and medications such as opioids, antacids, and some blood pressure drugs. What's more, thyroid dysfunction, particularly hypothyroidism, can cause both constipation and bloating due to slower metabolism. When this is paired with gas, it might be one of the first signs your body gives that your hormone levels need checking. Another concern related to changes in bowel movements and gas is colon cancer. While gas alone is rarely the first sign, gas accompanied by new, unexplained bowel habit changes, especially alternating between diarrhea and constipation, should never be ignored. Other subtle signs include narrow stools, a feeling of incomplete evacuation, and persistent bloating or pressure. If symptoms persist for several weeks or seem to be worsening without explanation, it's time to consult a healthcare professional for screening. Additionally, irritable bowel syndrome, IBS, often flares up in older adults, especially during times of stress, grief, or lifestyle changes such as after retirement or the loss of a spouse. IBS can cause either constipation, diarrhea, or both, typically with bloating and gas as central symptoms. Although IBS doesn't cause permanent damage, it can greatly reduce quality of life if not managed with the proper diet and stress control strategies. Let's not forget the gut-brain connection. Your emotions and mental health can have a powerful effect on digestion. Seniors who experience anxiety, loneliness, or depression may notice a sudden shift in bowel habits. Emotional stress can disrupt the rhythm of gut contractions, affect microbial balance, and increase gut sensitivity to gas and pressure. In fact, many older adults find that their digestion improves when emotional health is addressed alongside physical health. So what can you do if gas is accompanied by new or changing bowel movements? First, observe your symptoms carefully. Keep a simple diary noting what you eat, when symptoms appear, and how your stool looks and feels. Are they looser than normal? Are they hard to pass? Are there foods that seem to trigger flare-ups? This kind of information can be incredibly helpful for your doctor in pinpointing the cause. Second, make sure your hydration, fiber intake, and physical movement are consistent. Water helps soften stools, fiber feeds beneficial gut bacteria, and walking or light exercise keeps the bowels moving. Avoiding processed foods and artificial sweeteners, which can irritate the gut or cause fermentation, may also help reduce symptoms. Finally, don't hesitate to bring up these issues with your doctor. Gas plus a change in bowel habits may feel too embarrassing to discuss, but they could be your body's early warning system. Getting the right tests such as a colonoscopy, stool analysis, or food sensitivity screening can help you identify what's really going on and put you on a path to relief. In short, any shift in your digestive rhythm that comes with gas, especially when paired with diarrhea or constipation, is worth taking seriously. At this stage in life, Your gut is not just digesting food, it's also trying to tell you how it's doing. Pay attention, respond thoughtfully, and seek support when needed. You've earned the right to feel good in your body, and that starts with listening to even the quietest signals, like a gassy belly and an unexpected trip to the bathroom.